All right, Dr. Zaahir Moloo, physician and founder of Hello Mental Health. So, I've been working with you guys for several months now, doing some mental health counseling every week. Been really loving my time there. Why did you start the organization? You and your wife Sheila got this going back a couple years ago. How come?
Yeah, so we started during COVID. So I mean, there's professional reasons and personal reasons. Professionally, I think one having an interest in mental health and noticing that this is an area of medicine that's quite underserviced. So in my family practice, we'd have patients who couldn't access mental health care or therapy. Um, Oftentimes, they were priced out of therapy. They were out of a certain regional, catchment area. So there was a huge need for it, I think, and that was one of the primary motivators. And then on a personal level, obviously, I've had an interest in mental health for quite a long time, from residency, whether it's kind of doing electives, teaching myself CBT, DBT, and so it just kind of seemed when COVID hit, um, burning out of practice, it was a good kind of pivot and a good time to kind of start something like this. Yeah.
And so, you guys have been doing it for since how long now? Like 4 years?
Yeah. So we launched in 2020. So 4 years. Yeah, 4 years. It doesn't seem like it's been 4 years. I feel like we started more recently, but yeah.
Time flies. How
Yeah,
many
time
docs are
flies.
working with you guys now?
It's tough to say exactly. I don't know the exact amount, but about 30 doctors, give or take. And I mean, everyone works, their own schedule. Some are very, very part time. Some work a bit more, and so yeah, but 30 doctors.
And so it's all virtual. We're seeing patients like across the entire province. It's all phone call based for the vast majority of it. The patients don't seem as interested in video call. What do the doctors like about the job? What's the big perks?
Yeah. So, I mean, just right off the bat, it's very flexible, right? So you are talking to people on the phone. You could be wherever you'd like to be, in the province. There's essentially no labs or very minimal kind of tasks, very little note taking. A full day, for example, is just maybe 6 to 8 patients instead of, your family practice, which is maybe 30 or 20 to 30. So the pace is a lot slower. It's a lot more enjoyable. The overhead slower. And so lifestyle wise for doctors, I think they really like it. And number two, it's just a nice change of pace, right? When you're seeing kind of chronic medical illnesses and now you pivot to more mental health and therapy, especially, it's just, something a bit different. So that's another kind of draw as well, I think, building a new skill. And yeah.
Totally. Yeah, no, I love that you can spend like big quantities of time with a single patient. Like I'll regularly have appointments that are an hour, hour and a half. Every once in a while, I'll book somebody in for a 2 hour appointments, and just being able to actually like engage a patient for that long is like completely the opposite of sort of how we learned medicine and trying to do things in the fastest time span possible.
Yeah, it's definitely different. It gives you a different perspective. You get to know your patients better. You watch them kind of longitudinally in a similar way as family practice, but then you see improvements over time, right? And it's quite rewarding that way too. So yeah.
Oh, it's incredible seeing like the month over month progression in people's mental health, just recovering from abusive ex-boyfriends or to helping their depression get better or lessening their anxiety. It really is like incredible transformation in a very short period of time.
Yeah, exactly. It's quite nice seeing that.
And yeah, it's like a pretty very like casual, low stress job too. You're doing it like from the comfort of your own home. You get to pick and choose your own hours. The pay is great with like 20% overhead. I mean, you hook it up with Scribeberry, the AI scribe tool, so we don't have to actually write anything down and do note taking for those really long appointments. It's been really fun.
Yeah, a lot of perks. And I mean, on the opposite end too, like patients really appreciate it, right? So having access to therapy that's affordable, that's convenient, even if they're out of, big city centers. So it's been quite nice on that front too.
Oh, I imagine there's just infinite demand on the patient side for something like this, where they're getting psychotherapy counseling covered by their Alberta healthcare insurance plan.
Yeah, for us, our barrier has been, trying to get doctors and keep up with the demand because obviously there's a huge need, and so yeah, it's been a challenge.
If anybody sees this is thinking about signing up, what do they need to get started going with mental health counseling?
Yeah, I mean, I think they need just enthusiasm, and if they reach out, we'll make sure that they're trained, they have all the sufficient resources, and then they could get started. So pretty easy barrier to entry, and yeah, we're more than happy to have any interested doctors reach out and join.
It's surprisingly simple to get going. You know, the residency programs, especially in family medicine, seem to really cover a lot of that, like CBT and motivational interviewing. And you can really do quite a lot without a whole bunch of extra training. But that said, you know, that rabbit hole does go pretty deep. If you wind up really enjoying it, there is no shortage of like follow up learning to do and get better at your craft of being a counselor.
Yeah, exactly. I think so basics to CBT, DBT, allow you to see at least patients with anxiety, depression, maybe some emotional dysregulation. And then from there, if doctors want, they can always take on more complex cases or harder cases and build their practice.
And so if somebody's looking to get started, then what's kind of the minimum commitment required?
Yeah, so it would be 1 day a week to get started. So this could be on a locum basis, or if they want to join more permanently, locums would be they would take a set number of patients through a certain number of sessions for a period of time, and then obviously full time would be more ongoing and continuous. But that would be kind of the minimum commitment required.
Awesome. Yeah, so super easy to get going. You can do it part time, break up your week, add some variety in there. Overall, I can't speak highly enough of it. You guys have been a fantastic team to work with, so thank you.
Yeah, we appreciate it. Thank you, Jordan.